The Mom View is brought to you by Moms for America in partnership with the Herzog Foundation, empowering moms and championing Christian education nationwide.
Do you remember in 2020 when our government and medical officials made you watch your relatives die alone? Do you remember when they forced our children out of schools and they forced you to mask or vaccinate in order for you to shop and work? Well, that is exactly what myself and my mom friends are going to be discussing today on The Mom View. Please make sure that you follow us on Instagram at The Real Mom View and like and share with your circle of influence, and also follow us and visit our website at momview.com. We will be right back after this short break. Join us at The Mom View. Welcome back to The Mom View, everyone. Today we are going to be discussing 2020's tyranny and how that affected all of us and what that looked like for moms normally in our everyday lives. We will be having a special guest today to talk about medical freedom and how all of that affected us and what that looks like, right?
Well, it totally affected me. You guys remember 2020, that was when I had my ATV accident. A 50-year-old woman should not be riding around on an ATV, but I flipped it. I almost died. It crushed my collarbone. I had hematoma in both my legs. It was a mess. I go to the hospital and I am told that no one can go in with me at the emergency room. My husband can't go in. My daughter can't go in. Nobody can go in with me. They almost had me leave and go home because they said there's nothing we can do for you. And I wasn't there. I mean, I was not in my right mind to be able to talk on behalf of my own health care. And I had no one there to help me. And that's when I started to realize something's not right here. Right. And we did a video right after that, the COVID story no one's telling, the people who are sick, suffering, and even dying because they do not have COVID. Right? I had to go through surgery and everything by myself. And so when I started telling everybody about my experience, everybody on our team was like, oh my gosh, this affected me too. And it's like everybody was affected by the COVID because we didn't have COVID.
As a mom with a child with autism, when they decided to force mask our students in order for them to go to school, my child couldn't wear a mask. I can't wear a mask. And so I had to homeschool him. He had to be remote learned, and that was just an awful experience. There were children that depended on our schools for all kinds of things, for food, for escape from abuse at home, and it didn't matter how much we complained and how much we brought these issues in front of the school board. They didn't care. It felt like we were being completely ignored and we were raising red flags and nobody was listening. It was really strange.
And the amount of businesses that got closed down, right? Yeah. I was living at the moment in California and all these small businesses just went out of business. Right. Like they lost everything. Beauty salons, restaurants, they just lost all their income because they just shut them down. And there was nowhere to go, right? And then forcing you to get vaccinated or wear a mask to get in and buy groceries, or you cannot go in, like two people could not go into the store, right? Just one person, right? I never understood the toilet thing. That was my
Speaking of California, I moved from California during COVID, and it was crazy because we were on lockdown for about a year. The kids couldn't even play at the playground. They taped up the playgrounds, the outdoor parks. But what they did allow was protests. Right. And on every street corner, although the kids can't play at the park, you're allowed to have the BLM protests because it fit their agenda, right? So it was crazy to see how you're allowed to have a BLM protest, but you're not allowed to have your child play at the park.
Same thing happened in Illinois. I mean, I lived in the communist state, California. These were some really tough states to live in as a mom. I mean, my husband was being forced from his business. My son, living in Chicago, could not basically leave his home. My younger son taken out of school. Thank God I worked for Moms for America at that point. Because if you did not work for a patriot, freedom-loving business, you were forced in incredible ways to lose your business, forced for the vaccination. I mean, it really was a crisis. Do you remember, Kimberly, the amount of mothers coming to our website in tears? What are we supposed to do? Right. What's happening? They're taking over our lives and our kids.
Yeah, and you're right, Allie. It felt like we had no voice whatsoever. Right. We had a mom reach out to us from Florida Florida. Okay,
Florida.
in May it's hot. Okay, this is a free state. All right, she's in Florida. It's in May. It's hot outside. Her son's outside on the field for PE, and they're running, playing soccer, and needs to catch his breath. He's having a hard time breathing, so he takes down the mask. The teacher yells at him, makes him put the mask back on and run laps with that mask on for punishment. And this mama was like, oh no, 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 no. And she was all over the media talking about this. Nobody believed that this was actually happening to our children, but we were all experiencing it. And no one really knew what we do about it. Did any of you feel like you had a voice during that time?
My son had to play basketball with a mask on.
When we moved from California to Florida, there was still the airline had the mask mandate. Even if you have special needs or you can't put a mask on, didn't matter.
Oh, they weren't recognized as exemptions at all.
There was no exemption. So, and my son also, he has autism, and we were really nervous because he would not wear the mask. We were nervous to put him on the airplane to move from California to Florida. So what we did was we took him on the airplane, and there was a rule that you're allowed to eat. And once you take off, they're not going to land. So until the plane took off, my poor son, we cashews, chocolate.
Right.
We didn't. We held both of his hands down.
The amount of people got kicked out of planes from babies, toddlers not wearing masks. It was ridiculous. I mean,
complete government overreach.
Yes.
And we allowed it. A lot of us allowed it because one, we didn't know what to expect, right? But there wasn't enough of us to gather together to petition or fight back or do rallies or anything like this, because they had us in such a fear stronghold, I feel like. But the moms that were speaking out were very effective. I mean, we had...
And on top of it, there was a division, right? Because I don't know about you guys, but I had family members that literally uninvited me for birthday parties or holidays because I'm not vaccinated.
I had people that came to me and they would say, it's just the mask, okay? Just get over it. It's no big deal. It'll go away. Just wear the mask. What's the big deal? And I kept telling them over and over again, it is not about the mask.
Right.
If they can make you wear a mask, if you're going to allow them to do that, then they can do anything. They can make you take a shot or put things in your body. And they kept saying, oh, no, they'll never do that.
Right. Well,
they
the
don't
freedoms
understand.
you give up.
That's right.
The freedoms you give up now are the freedoms your children or grandchildren will never know existed.
Absolutely.
Exactly.
Well, and we're kind of feeling it right now.
And when like I have an autoimmune disease, there's a lot of people that have very legitimate concerns about that. To be forced to do something that could be very harmful to you, and there's not enough data out there. We have no idea what this vaccine would do or not do.
Or sexual abuse victims, rape victims.
Right.
Those victims cannot wear masks. Yeah. And that was something that struck me as well, because when you go into these businesses, and these businesses are under code by the city to police their own community, to tell them that if you're sitting down, you can wear one. If you're standing up, you can't wear one. It's like, it was ridiculous. These rules didn't make any sense.
It's like the coolest disease ever. I know. Because it only levels right here, and you stand up, and suddenly it's gone.
Yeah,
it's only 16. Only 16.
And what was wild is bars and strip clubs were open, but our schools and parks were closed.
And now it's they call it the common flu. That's it. Mm-hmm. COVID is now just the same as the flu. So.
But we were telling them
that.
We
were all right. We were all right, and we knew we were right. But they kept saying, no, you guys. But we were.
Anti-maskers are extremists. Anti-vaxxers are extremists.
Dividing and conquering.
Yes.
Okay, so there was this meme that came out. I don't know if you guys remember this, but there was this king, and he's standing up on this tower, and he's got his aide beside him, and all of these people, the peasants, are down on the ground, and they've got their pitchforks, and they're all upset and angry, and the aide leans over in his ear, and he says, we don't have to conquer them, we just have to convince them that the unmasked people are trying to kill them.
Yep.
So they're pitting the masked and the unmasked. It's like ridiculous. And I remember I was at a store in Maryland, and depending on where you were at, I mean, you guys, you guys were both living in like a very deep communist state. Mm-hmm. And so I go into Maryland, and there's this mom with her 2 little kids, and we're at Target, and she's in one aisle, I'm in the other aisle. And I come around the corner, and she grabs her kids, and she goes, come away from that woman. Come away from that woman. She's not wearing a mask. Right. And they take her, and I'm like, oh my gosh, what are we doing to our kids?
And we know that the masks didn't work.
No,
That
it
was
did not.
that was the
Fauci
biggest.
even said it right at the
Right.
beginning. Don't
Right.
wear a mask; it doesn't do anything. And then all of a sudden, wear a mask or you're all a bad person.
Right.
I compared it to putting like a plastic bag or some kind of something over your exhaust when you're driving. It doesn't make any sense. It doesn't. It didn't make any sense from the very beginning.
When
it
I
just,
see-
it was wild.
Yeah, when I see somebody wearing a mask now, I'm like, oh, you're just trying to let me know you're voting for Joe Biden.
Right. It's a vote for Joe. You know, the other thing that really bothered me was just the fear mongering.
Oh yeah.
I was working in a state representative's office at that point, and as the chief of staff, it was senior after senior calling saying, I need this vaccination. I need it because I can't see my grandkids. I'm not going to make it. I'll die if COVID hits me. The fear was just tragic.
Right.
And for no good reason. And then to force all this and divide families, that was really, and years ago someone said to me, the medical freedom is going to be the battle that is going to divide and crush America. And I didn't see it coming. But boy, as soon as COVID stepped in, we all saw it. It was just
I
incredible.
never thought in a million years
Medical.
this is where we'd be.
Right.
Never. I never thought that. And then to see my own child, my oldest, who is very social,
Right.
he really did enjoy being around his friends, become a recluse,
Sure.
and now have social anxiety. It crushed me as a mom. Like, how do you fix that? I get emotional because he loves to play football. He loves to be involved with his friends. And just to see that completely become deflated in him was just something that I couldn't deal with. And I had to step forward and gather more people around me to say, hey, we have to petition our government to stop the nonsense. Even in Florida, it didn't matter if you were in a free state or not.
Yeah.
It depended on who your government representatives were locally. It doesn't matter who the president is. It doesn't matter who your congressman is. What matters is who is your local representative, your city council, your school board members, your local representatives, your county commissioners, your sheriffs. If your sheriffs should have stepped up and said, absolutely not.
Right.
They are the in between.
You bring up such a good point.
Yes, absolutely.
Because, prior to 2020, we're all trying to convince people everything's local. You're not going to change anything in Washington. We don't drive or get on a plane and go up there and vote for anything. Or you don't change things there. You change things locally. We don't have to convince people anymore. So while there were a lot of horrible things that happened in 2020, there were a lot of good things. People realized it's about local.
Yes.
And we have the power to change it right in our own backyard.
We always have.
Absolutely.
It is we the people, for the people, by the people. And that's one of the great things that happened in 2020. It was eye-opening, right? We had so many moms become more involved in politics than ever before. So many new people running for office than ever before that have never run for office before. And almost all of them won. I mean, I was part of a group that petitioned people to run for office in 2020. We had Moms for Freedom in Florida, and we had a reopened rally in Tampa. We had 500 people show up to that rally. We made international news. We petitioned everybody that was running for office, everybody we liked that aligned with our values. They ran, we did their primary. We all were out there baby wearing and stroller pushing and door knocking for them. And they all won their primary and only 2 lost their general. That is the power of community. That is the power of having conversation. That is the power of our mom's voice, right? Of the view that we hold.
But
because
I
everything
think that
affects us as a
also
family.
2020 brought us a wake-up call against the medical corruption.
Absolutely.
Right? As a whistleblower about the medical business, right?
I mean, how many of us
business.
trust our doctors now?
Exactly.
That was who thought that was going to be a thing?
Exactly.
I mean, where is their allegiance? Is it to their patient, or is it to the government, or is it to the
pharmaceutical
money,
companies?
or the pharmaceutical companies? Where is their allegiance?
There was so much money in this.
There is.
There was so
And
much
it's-
money in
and
this.
what's scary is how many people just fall right into it. I mean, for me, I said my kids in California will have to get vaccinated to go to school. In Florida, they don't. Easy choice, moving to Florida.
We're out.
But I had friends there that they're like, well, I'm going to get my kindergartner vaccinated. I'm like, why? Are you scared that they might get COVID and something bad might happen to them? No, I just want them to be able to go travel on their traveling soccer team. So you're going to give them this shot because
They force them into it.
Exactly.
Experimental, by the way.
But you don't even know what you're giving
Keyword.
them.
Experimental vaccine.
You're not worried that they might get sick.
Right.
And so I'll give them the vaccine so they won't get sick. You just want them to continue with their activities, so you're going to give them whatever the government gives you.
And
You know, the most tragic thing about all of this is what it did to our children.
Absolutely.
And all the videos that were out there, the cute little cartoons of how to mask your child.
Right.
I mean, I
even
was
on
like,
Sesame Street, they just did the whole thing where
yeah,
everybody
almost wearing a mask. I mean, this is absolutely
crazy.
Well, the one thing that I think we really learned from this is we're going to gravitate to freedom.
Yep.
And instead of, competing for oppression from the federal government down, let's build up from the local community up.
Absolutely.
And people are going to go where freedom is. And that's why Texas and Florida have just exploded, and Illinois, they're all leaving.
We're full.
California,
Florida's full.
California, they're leaving. Yeah, Florida's a little overwhelmed right now.
And it's election season, so who knows
right.
what might come up, in the next few months.
That's right.
And that's why we're doing the show, Kim.
Right.
That's
Yes.
right.
To help our
Gravitate
mamas.
to freedom. That's where we're
Gravitate
going to
to
go.
freedom.
We will be right back with our special guest, Tanya Parus, who's going to tell us more about how we can make a difference in our own local communities.
The Herzog Foundation exists to catalyze and accelerate the development of quality, Christ-centered K-12 education so that families and culture flourish. To do so, we've created comprehensive programs designed for Christian schools across the nation. One of those programs is found at readlion.com. The Lion carries news articles covering issues especially related to the education of children. These are timely, critical, must-read articles for families, educators, and leaders. Another program is the Herzog Foundation Institute, where we provide training for Christian educators led by national thought leaders in subjects such as marketing, donor development, and culture building. All training events are fully funded by the Herzog Foundation. And finally, with new Christian schools popping up all over the country, we've created a free online resource to help with the process. HF Schoolbox provides lessons and free mentorship to help launch groups navigate the startup process every step of the way. We're the Herzog Foundation. You can find out more at herzogfoundation.com.
There are a lot of people who were affected by the COVID protocols and the things that were happening at the hospitals, our schools, and our classrooms. One of those people is Tanya Parus, and she is one of the Moms for America rock stars from Florida who was affected by all of this. And so I just wanted to talk to her about some of the things that were happening in Florida, because a lot of people think that, Florida is like this conservative state, and so everything's fine. But not so much.
No. Florida, I think we did have our advantages, but there was a lot of local action that needed to happen in Florida. What brought me into it was in 2020, I was at EMT in my prior life, and I realized that this whole mask wearing was absolutely ridiculous. It didn't even make sense. I knew that in training, when I was going in through any type of training for the PPE wearing, that it didn't help about viruses. It didn't help to do anything except for instill fear. So what was crazy to me is I realized these doctors were going along with all this. So that spurred it for me. And then, of course, our kids, they stayed home, they were learning on the computer, and I thought, this is absolutely ridiculous. Kids are not dying from this virus.
Right.
Why are we...
They weren't even getting sick from the virus. Why were doctors so easily buying into this? I mean, that's one of the things nobody can understand.
Well, a lot of them they're not on their own anymore. They're underneath, they're an employee, basically. So, you think about a doctor, they don't just, walk out of medical school and make tons of money. They have a lot of bills to pay.
Right.
And so the feedback that we got was just, they couldn't do what's right because of their money. So they got everybody where they needed to hit them. They got people, obviously you had to get a vaccine to keep your job. If you wanted to keep your job as a doctor, you couldn't say anything. And that ultimately led to murder in the hospitals.
That was the thing that just made me insane. All the people that were diagnosed with COVID, I mean, all of the things that it suddenly treated, like motorcycle accidents. Mm-hmm. And I mean, all these people are coming into the hospital being tested for COVID, and what we realized was that the hospitals were getting paid federal money for COVID deaths. And they wanted to have apparently as many COVID number deaths as they could get, whether or not they were real.
It's worse than that. They were getting paid for every COVID test, every COVID positive test, every patient on remdesivir, and then any patient that was intubated with remdesivir, they got a 20% bonus.
Wow.
So you basically, it depends on the state, but in Florida, we were about $475,000 was the price tag of a person in the hospital.
That's a person's life doesn't have a price tag on it.
Yeah.
It just infuriates me. Okay, so there was this woman when you guys had this big medical freedom rally down there in Sarasota, and I met this woman. She came up to me after I spoke, and she said, "I need to tell you my story." And her husband had gotten COVID, and he had a really bad case. He's in the hospital, and he was dying. They had him on the ventilator and everything. And she said she kept seeing people being rolled out, people who had died. And she said, I hope he doesn't see this. And she just couldn't take it anymore. She's on the other side of the glass watching him. She can't be with him. They can't be together. And finally, she convinced one of the security guards at the hospital to smuggle in ivermectin so that he would get the medication that he needed. And it saved his life. And 3 days later, he's out of the hospital and perfectly fine. So there were a lot of people who did the heroic thing. I mean, once he had the ivermectin, the medical staff had to continue to treat him. They couldn't just take it away and say, no, we're just going to keep letting you die. Right. So there were people out there who did do the right thing at difficult times. And you met a lot of those people.
Yeah,
right?
Absolutely. We knew nurses that would smuggle in ivermectin. They would put it in Bibles. They would bring it and they would tell them how to take it. We had nurses that found out, after you see so many people go on remdesivir and they're all passing away in a gruesome death, they stopped giving remdesivir in the IVs. They wouldn't even push the medication in there and the patients were surviving. Has obviously, that's a good and a bad, because then doctors look at it like, oh, they did survive, but nurses did the right thing. Some of them did, and others, just put a blind eye up and just continued on to collect that paycheck. But there was a lot of heroes, and a lot of those heroes are still very front and center today, and most of them have all lost their jobs too.
They say that difficult times will bring out your true character.
Yeah.
And I think that's really what happened.
Right.
When we saw what happened in 2020. So you live in a very unique community. Most hospitals across the country are privately owned, but you have a hospital that is voted on. They have a public board, and you have elections. So how does that work exactly?
So there's two hospitals in Florida, Lee County and Sarasota County, that are basically, they're county funded hospitals, and they have publicly elected boards. So there's in Sarasota County, there's a board of 9 members that sit on the board, and every 2 years there's an election for those board members. 5 one year, which was 2022, and the next one's coming up. We actually ran a slate of candidates back in 2022. They were on a slate called Medical Freedom, and we actually got 3 out of the 4 on there. So now we have 3 Medical Freedom board members that are sitting on the hospital board that are advocating for medical freedom.
But you have like another election.
There's another one coming up, and that one has 4 openings, so 4 seats are available, and I put my hat in for that one.
That's
so
awesome. And you're running a slate again.
We're running a slate again.
So if you win all 3 of these on medical freedom, you will have 6 out of the 9 who will be medical freedom on that medical board. That's huge.
And that's how change happens. We at least figured we need at least one hospital to light the way for all these other hospitals to see how it's done. So I think some programs that introduce early treatment for COVID, and not even just COVID, right? Because they've basically written COVID off. However, they're still following the same protocols in the hospital to date.
Wow.
But any time that this ever came back up, we need somebody to be in our hospitals to keep them safe, and that's what I intend to do.
So how do we protect our children in this medical system now? Where, for example, I don't trust the doctors. I have gone from doctor to doctor to doctor until I can finally find. I always ask the question, and when they answer the question wrong, then I go to the next doctor. And the question always is, how do you feel? What is your position on ivermectin for treating COVID? And well, there's not been any proven. Okay, I'm done. Move on. Because it is proven. And I remember every time they kept saying things about, it's a horse pill, it's a horse pill. If a horse pill is going to save a life or keep them from being sick, give me the freaking horse pill. Right. I don't care.
Exactly.
And that's, as a mom, I want to make sure that my children are safe and protected. So what do we do in a system where we're not sure we can even trust the doctors anymore? Where is their allegiance?
Unfortunately, medical and healthcare has turned very political. So now, you have to ask these questions, right? That it's just a political line has been drawn. But basically, as a mom with children myself,
you need to find a doctor who supports what you believe in, and they are out there more so than they were 2 years ago, more so than they were 4 years ago. So that's the most important thing. I started We the People Health and Wellness last year, which has pulled away from any type of government funding. We don't take any type of insurance, and that's what doctors really need to start kind of pushing towards. Getting away from that system, getting away from that umbrella that governs these doctors into making decisions that ultimately impact children.
Well, there's something that started, I guess it was about 5 years ago before COVID, and it was called patient subsidized. And it's basically you're joining a clinic and you're paying a certain amount of money a year for you to go and be able to get general health care, medical care. And then if there's anything additional that you have a price sheet of what that's going to cost. And I think a lot of people are looking for that so that they can start creating health savings accounts or create their own savings for that medical attention that they need. There's also, I think, a lot of quote healthcare. I think people mix up healthcare and medical care because healthcare is our responsibility, what we're doing and taking care of ourselves. Medical care is when you need that extra thing. So even, my personal opinion is when, they say you need to come and you need to get these appointments with your doctor when your babies are born, 2 months, 4 months, 6 months. I bought into that when my kids were young, but that was a time where I felt I could trust my doctor. I don't feel I can anymore. And so you've got these young moms who are going in for these, scheduled appointments for their baby physicals, and they're at the whim of whatever that doctor tells them. And if you don't do what the doctor says, you feel like you're a bad mom. So how can we empower these moms in this?
So like you talked about subsidized. There's also direct primary care. So doctors are starting these direct primary care centers to give the patient autonomy so they can have a real discussion with them, and no pressure, no judgment is what you're looking for from a provider. Any physician, pediatrician. As far as a lot of people have pulled away from wanting to even vaccinate their children anymore. They just don't want any vaccines.
Well, who knows what they're putting in it?
I don't disagree with them at all. And I think as a mother, that's your choice, what you want to do with your child. And I think there's a lot of pressure there to vaccinate your children. Whether they want to go into the school system or not, there is ways around that they can choose to either keep their kids home and have them homeschooled, or there's other different things that they can do. But the biggest thing is having somebody on your side, and I think that's the scary part, is getting a great pediatrician, family nurse practitioner, somebody that can really advocate for you. The biggest thing I think as a mom is you want to have informed consent. You want to know what you're getting into, and you really need that trust there with your provider. You have to have that. That's
so if you don't have that, where do you go get that information so that you know that you're at least informed enough that when you go in with the doctor, if they say something that makes you feel uncomfortable, you know that you can walk out or you can disagree? Is there a place they can go to get that?
There's just a ton of websites. There are a ton of things that you can do to look up what's in the vaccines and where your comfort level is. I know Del Bigtree did a lot on that. And I don't recall the website, but there's a lot of information there.
He has ICANN, and I don't remember his website either, but absolutely. Del Bigtree did. You're right, he did.
And just find somebody that is in your community that is supportive of that. Most naturopaths, I know it's not legal to be a naturopath doctor in Florida. You can't have a license for that.
But
But you can look for naturopaths or functional medicine. That's really where you want to turn to. Even with chiropractors, reach out to some chiropractors. They look at the holistic side of you. They're one of the heroes too. I just want to mention that. Those are some of the guys that stood up and said, hey, we'll sign mask exemption forms for you if they're mandating these masks for your children in school.
I am glad you brought that up. Okay, so you did this in Florida. Tell us how this worked, because we may need this again.
So when all this came down in 2021 with forced masking our children in schools, our county broke the law. They just disregarded the law. There was a law in place that said they couldn't force mask our children. They did it anyway. And they had $1 million lawsuit on their hands a year later, which was our tax dollars that we were paying for. So they didn't really care. Big, huge thing happened where they gave parents like a week basically to get a mask exemption form if that's, if you could get that. But they wanted you to get it from, anybody that could sign these waivers. Well, people went out in droves and were hitting up all the chiropractors in the area, and the chiropractors were signing the forms. And then the school board changed it in 2 days and said, all those forms are irrelevant. No chiropractors can sign it. Only a nurse practitioner or higher, a DO or a MD could sign those forms. So we hustled, and in a few days, we put on a volunteered event where we had a nurse practitioner and a few doctors that were on a location where we organized like an assembly line of kids coming in with their parents to do vitals and then a physical and then go see the doctor and get this mask exemption form signed off. Wow. We anticipated a couple hundred. There was over 3,500 people in line.
Oh my gosh, this is amazing.
It was amazing, but it was very emotional.
I bet.
It was really upsetting because I was one of the people that was taking the vitals because I used to be a EMT and medic. And, people were coming in after standing in line in the it was in August in Florida, and they were standing outside. And at like hour 9 or 10 of standing outside in this heat, people were coming in, and parents of autistic children that they were saying, my child's doctor won't sign a form for them. Clearly, these kids were not able to wear a mask.
Right.
They wouldn't even let me put a blood pressure cuff on them. And I'm thinking, how are you going to get these poor disabled children to even wear a mask? And why are we doing this? So like I said, it was very emotional. I shed a lot of tears that night. And then we ultimately had to close it down, and we stopped at 11:30 at night because the doctors were exhausted. And we couldn't do it was probably about 2,000 we couldn't do.
Wow.
Yeah, we tried. We really tried.
But that's something that people don't, when they look at the problem, a lot of people will just be like, oh, well, there's nothing we can do. But you're one of those moms that said, no.
There's always something you can do.
We're going to get something done.
Always something.
So we're going to come back. I want to have you on the couch with the ladies because we want to talk about some of the other things that you have done that are solutions to these problems. And we'll be right back.
America is under attack. Our families are being crushed under the politics of a radical agenda. But moms have had enough. We are standing up and we are fighting back.
This is our battle. This battle is every bit as important as the Revolutionary War because we fight for the same thing.
Moms for America is a national movement of moms reclaiming our culture for truth, family, freedom, and the Constitution.
I think Moms for America is exactly on track and is doing the right thing for the future of our country and our children.
Moms for America is going at the heart of the issue.
I want to go on the record and say I'm for moms, I'm for America, and I'm especially for Moms for America.
But I am honored to join Moms for America today as we speak out against the horrific mandates.
With a national network of over 500,000 mothers, Moms for America is one of the fastest growing movements of women in the country.
Well, the most dangerous place in all of nature is between a mama bear and her baby cub.
We are the change. No matter what, no matter where, and no matter how difficult the obstacles are that are facing us and our families, we will not give up and we will not give in.
So if not now, then when? If not you, then who?
Welcome to the Momland Revolution. So Tanya is back with us here on the couch because all of these moms have a lot of questions. And one of the things everybody talks about is how Florida was so free during COVID. And obviously there were issues there, but it is true that Governor DeSantis' leadership made things a whole lot better in that state. And you at least had the state laws to be able to rely on. But other states didn't have those luxuries like Illinois.
So Tanya, my question is here in our state, 41 state of emergencies. I mean, proclamation after proclamation, 3 years, every time he would do this, the entire state would shut down again and he would have ultimate control. Yes, we have got to work on electing governors in our states and local government that will rule much better and much more efficient and for the people. But what do we do in states like Illinois or California?
I think it's just all about local. It's just completely about local level. You got to start working at local level. Everything from city council to if you do have a hospital board, any type of board that you can get on or a position that you could run for, and it's got to be grassroots. We need, I think what we saw was we did a major push for getting new candidates to run for office, but then we saw them flip. And it's like, holy moly, we're up against this too. So I think, your grassroots people, the people that have been in the fight, these guys need to run. They need to start running. You start impacting at the lower level, and then people start getting involved, and you take those groups and then you start raising them up into other higher levels.
There's nothing more powerful than a grassroots group of
No,
moms,
there's
right?
not.
So you did something very unique. You saw a problem. You had all kinds of incredible solutions, but you just went over the top. I remember when you called me and you said, I'm starting a clinic.
Yes.
So tell me, how do you do that?
That's what we need, more clinics like yours all across the country.
I started with Sarasota County Moms for America. And then I was a conduit, which I was talking to people who were needed to be rescued from the hospitals. I was talking to people who were needing early treatment for COVID, and I knew the doctors and nurses that could get them help in all these different situations. And basically, I was only one person, so I'm like, why don't we have doctors' offices? And I kept asking these doctors, can you make a statement that you're prescribing ivermectin or that you can help people? And they were kind of clambered down, and they were afraid. And I saw the need was there, and so I figured, what the heck, I've done so much already. And I've raised 3 boys, and I still have hair on my head. So why not start a clinic? And I started digging into it and figured, well, I know the doctors, I know nurse practitioners, I know everybody. What do I need to do? And I started talking to attorneys that were in the healthcare industry, and they were like, yeah, it can be done. You'd probably need to go a direct primary care model, which means that you wouldn't be able to take insurance. And I was like, absolutely wouldn't want to take insurance. That's where the governance comes in. So I didn't want to do that. So DPC seemed like it was phenomenal. And our old governor, Rick Scott, had put a bill into legislature for it. And other states have this. So doctors can actually step away from that insurance model and start a direct primary care. They can even, they can even.
It requires courage.
It requires courage. And we
funding.
need.
I mean, the community has to get around this. Everybody really has to rise up and say, I will help, I will contribute.
You had 35 people who showed up at this, line to get a piece of paper signed. So surely you've got, if you can get those kind of parents, families involved, then they can buy in and pay into that. And how does your clinic work with payment? Can they do like a monthly payment to just be on the docket, or is it paid for service? How does that work?
Sure. And well, let me step back. We named it specifically We the People Health and Wellness Center.
Awesome, isn't it?
I did not want to hide. I said, I'm already front and center. They've labeled me all these things. I'm just going for it, and we'll see what happens. And so I think the name is important, or you have to really kind of, get that out there that you're willing to help these people, because there are other direct primary care practices. I don't want people to think all of them are the same, that maybe the doctors don't feel this way. So I think that's one of the big things, is to show your cards.
So they have buy-in. The doctors, all the medical staff, they have buy-in before they even walk in the door. So they're there. And then the people who are coming, they're clearly seeing this is who we are.
Right.
So they probably are already willing to make whatever sacrifice it is and come in and get what they need.
And then we have a membership model. It's very simple. They get unlimited visits. They pay a monthly membership fee, which is really low. Like an adult in their 40s pays, $85 a month. Unlimited visits. So instead of going to your urgent care, we can do stitches, and really it's ultimately up to the doctor what they want to do in their practice. So if the doctor specializes in something, they can offer that there, and they're covered under the
so
direct
you can
primary
pick a specific doctor in the clinic?
Yeah, we can have all different types of doctors in there.
Medicine should be.
Yes.
Concierge.
Yeah.
Concierge doctors.
Well, concierge still uses insurance model, which is another opportunity for them to start branching away. So they can do a type of concierge, and then they could do like a hybrid model and half, and then ultimately get enough patients. I mean, most doctors are like, well, you know, I want to make millions of dollars, but I think now over the last couple of years, they're like, you know, this freedom is ultimately what I want.
This is a great solution for so many doctors to have a facility like this.
Absolutely.
You're seeing this all across the country now. Again, you're in Florida. I'm in a tough state. A lot of moms that are watching are in tough states. We have to build a parallel society, right?
Yes, absolutely.
And everything from education to medical.
100%.
Are you seeing this across the country and other?
Yeah, no, I definitely am. And I think what's happened over the last couple of years is parents started doing their research, which, you know, some of these doctors we know don't like to say that it's good to do your own research. But they started doing their own research and finding out that, hey, you know, vaccines are an issue. I don't want to vaccinate my child anymore.
Right.
Or they started figuring out there's alternative medications, or not medications, alternative things to medications. And that's a big deal, right? Your functional medicine versus allopathic, and what are the differences between those type of physicians. They started figuring out who to go to, who to talk to. And now just becoming more informed as a mom that's more artillery that you have than we had years ago. So as a mom, you know, we talk to so many other moms, and we give them and feed them that information. So I just tell the mom, just
And I
dig.
think one of the things that after the pandemic, so you know, telemedicine, they've been trying to push it since 2014, 2016. But I think the pandemic kind of launched the telemedicine, and clinics like yours, can you serve patients from other states?
Well, when the emergency authorization was in place, every doctor could go across state lines and help telemedicine. Now they've backed that back down into just in the states that the doctors are licensed in. So it's a really big deal if you can be a doctor licensed in multiple states, because you can do that. We are also trying to start a program that's a telehealth side that would be able to do it nationwide.
Nice.
Yes.
Right.
So
That's what we need.
Very interested in
Kimberly, with the telehealth, I mean, that is really, when we got COVID, that's exactly where we went, and it was huge.
Well, early treatment was the biggest thing that everybody missed during this whole thing. They tried to, and the reason for it, the reason why they didn't want early treatment was because if there was a way to cure, heal, treat COVID, there was no reason for the vaccine.
There was no reason for the mandate.
That's why they killed hydroxychloroquine.
Right.
That's why they killed ivermectin. They did studies that were designed to fail. And something that I think a lot of moms need to know is that these doctors rely on these journals.
Yes.
And they rely on those because, like, for example, a primary care doctor, to be up to date on everything they need to know weekly, needs to do about 26 hours of research. That's impossible for a doctor. They just don't have the time. So they rely heavily on these journals. But these journals have been fraudulated. I mean, they have been so bad for so many years.
Even going into medical school, and that's the problem. Before they even graduate from medical school, they've already been, I wouldn't even say indoctrinated into these ideas. And it's political.
It is.
It's become a politicized market instead of healthcare and medical care where you have a relationship with your patient. It's all about politics. And the politics should be taken out of things that aren't political. And in my healthcare, my children's healthcare, medical care, that is not political.
And standing by your Hippocratic Oath, I think, is important. And providing true informed consent for our parents and our moms is so important as well. I mean, we shouldn't have to do our own research. I mean, of course you should. It's important. But not on everything. With the amount of things that we have on our plate as moms, you are supposed to trust your doctor that they have your best interests at heart, your health care in your best interest. And when you are relying on medical journals that have been bought and paid for by government or have pharmaceutical companies, you can't trust them. It's difficult to do. And so making sure that your doctors are abiding by their Hippocratic Oath by doing no harm, which is first and foremost, and making sure that you are providing true informed consent, which is what I love about your clinic. You guys make sure that you have and you build that relationship with your patients. And
I know it would be great, and I mean, you still have your hair and you've done all these other things. But how, a how-to that maybe we could provide, go to your clinic and say, this is how you can do it where you are. So maybe other people that are feeling that urge and urgency and desire to do something that they could do.
Well, I'm actually, we're gearing up to light up more locations.
Oh,
fantastic.
So,
like in other states?
Yes.
That's
to where we have something what you're talking about. It's going to be, it's not a franchise model, because that's federally governed. But it is going to be an opportunity where you could buy into either the name, the license, open up your own location, do your own location, and we can come in and teach you how to do it. So we're getting all this set up.
There are a lot of parents in California who would just be like, I've been spending a lot of time in California over the last couple of years, and I'm just blown away at what the families there have dealt with, and these moms are just hungering for anything in the education and medical. Those are the two big things that have the closest impact on their families, and they are just dying on the vine out there hoping for help.
So with opening all of these new clinics, if you're going to do this nationwide, how are you going to prepare for the backlash that you're going to get from the doctors that are bought in through the medical industry, the pharmaceutical industry, because they're going to come after you? So what plan do you have to mitigate those?
They've
those
already
attacks?
done that.
Well, I know, but when you expand, it'll be worse.
I mean, I think it takes a certain type of person to stand up to that.
Right.
So, obviously, if whoever's opening that center that has to be a certain type of person.
It has to be a bull shark, like Tom.
Of course. Do you have lawyers that are willing to step in and help?
Yeah, we have great lawyers.
Good. That's always important to know.
So,
I want everyone to know, if you're going to open up a clinic, they have help.
Get a lawyer. Yes. The biggest thing is you dot all your I's, cross all your T's, right? And I know, being in this industry and having there's a lot of doctors who they're not following all these, Department of Health regulations to a T. Our clinic, because how I am with being very protective of it, had already anticipated that. So we are doing things that we don't even really have to do just to make sure that we are compliant and make sure that we are good to go and they can't shut us down. That's the biggest thing. I imagine, the heat could be turned up rather quickly. Department of Health in every state. Things can come out really quick. So, you just have to be prepared for that.
Courage is contagious, and when you're standing on the right side of things, nothing is impossible.
Right, and moms can get stuff done. You have totally empowered us. Yeah. This is great.
Is everybody ready to open up a clinic?
Let's do it.
And I was going to say too, Kimberly, there's a lot of rock stars around the country that stood up for medical freedom. Right. I mean, Dr. Peter McCullough just spoke at our summit recently. Dr. Simone Gold. I mean, there's a lot of doctors. This is the hope. They're speaking up and they're helping, us all stay healthy and educate us. So kudos to all the doctors and the nurses that have stood up. We appreciate you.
There are major heroes out there. And like I said, when the times get difficult and really difficult, then the true character of people comes out. And you could tell who the heroes are. They're willing to stand up and do the right thing, regardless of the backlash. Yeah. And you just done incredible things in Florida. I'd love to see that around the country. It has been amazing having you on the show today. And we look forward to having you back. And we will be right back on the Mom View. What kind of America do you want to leave future generations? What do you want America to look like for your children and your grandchildren? Our nation is at a crossroads, and it will be us, the mothers of America, who will determine the future of our country. What we teach and nurture in the hearts of our children and how we vote will make all the difference. If you love God, respect life, honor family, and cherish freedom, then use your voice and be heard. We teach these values in our home. Let's secure them with our vote. So I hope you enjoyed hearing from Tanya as much as we did. What do you guys think about that? It's pretty cool.
Well, it was very, very interesting, but she has accomplished in Florida. I love to see that across the nation, right? It scares me what they have planned next. Right. And we need to gear up and be ready.
And you're in Arizona, right? So let's take it to Arizona.
Yeah, let's take it to Arizona. Let's turn Arizona around.
I would just like to say to the moms that are watching, you are so important. I mean, you have the power in your home. You're the greatest influencer in your household. So be encouraged and be inspired. That's what the show is all about.
In your community, yeah, we need you. Your community.
And we can't be everywhere. Tanya can't be everywhere.
Right.
You know, you have the most influence in your circle of friends, in your circle, in your neighborhood, in your communities, wherever you are. Make sure you're having those courageous conversations with people and encourage them, inspire them to start something new, to start a clinic like Tanya did, so that we can spread freedom across the nation once again.
Right. And I mean, we saw what they did last election. We're here again. We're at least prepared, and now we know what they could do. And so at least now you have the mom's view, and you have people like Tanya that are ready and prepared, and they won't let it happen this time.
We are here for
I mean, this isn't a place where moms can gather together and connect.
Yes.
Yes.
And knowledge is power.
That's right.
We always say we're the ultimate support group, and that's what we are. We are here for you, moms, helping you in your journey through motherhood.
So one of the big things we're talking about has to do with parental rights. What are our rights as parents, and how can we make sure that our children are protected? So Moms for America has put together this really great little booklet called Parental Rights Guide. And you can get it, download it right on our website at momsforamerica.us in English or in Spanish. And we love hearing from you. So if you want to share your mom view with us, visit themomview.com and tell us your mom view. And make sure and remember to like, share, send it to everybody. This episode and every episode of The Mom View on Instagram at The Real Mom View. And we'll see you next week on The Mom View.